and welcome to Outside the Box 2020, the Healthcare Edition. And I am here again today with Dr. John Rothwell. And Dr. John, how are you doing today?
I'm doing well. Thank you for asking. And like I always remind you, Dr. John, nurse practitioner. So I have a doctor of nursing practice. I'm not a medical doctor or a doctor of osteopathic medicine. I'm actually a doctor of nursing practice.
But you're amazing. And I always leave that to you because I can never remember all the letters that go with what you do. But all I know is that I love you and I'm so thankful to have you in my world. So whatever, all of that stuff, I know you have to say it, but you're Dr. John to me. So today we're going to have just a little quick discussion about a subject. We're in the middle of, I always try to mention the date that we're talking because who knows, if somebody's watching this, they may not know the date reference. It is May 27th of 2020, and we're hopefully on the backside of the pandemic and quarantine. Everything's opening and we're trying to resume life somewhat. And we've been going through this COVID-19 thing for what, like 10 or 12 weeks or something crazy? Yes. It's been nuts. So I actually have a friend who had COVID-19, got really, really sick. She was not hospitalized, but she did have to go to the hospital. She had double pneumonia. Very healthy, active person. Very active, goes out every day, plays golf, runs, plays racquetball, all of those things. And she got really sick. She was down for about a month, I think. And I've noticed recently that, she has said that although she is resuming her activities, that she's just not quite up to par. And it's been probably close to 2 months now since the initial onset. So kind of made me wonder a couple of things. One, are there things that are going to stick with you after you have COVID, like forever and ever, amen? Or is the recovery period just like a really long time? So give me your words of wisdom on that.
Oh, wow. So a lot of short questions that are very big in everything that you just said. And like with the beginning of the SARS-CoV-2 virus or COVID-19, there's a lot of unanswered questions. And while structurally COVID-19 is very similar to the SARS-CoV virus that we identified in 2002, 2003, this virus has been rather challenging. And so you mentioned a couple key points there. Friend, positive COVID-19, non-hospitalized, relatively healthy, double pneumonia. And so if you think of medicine and disease processes that are complex, it's like putting a puzzle together. Because with COVID-19, we found that there's lots of pieces to this puzzle. So what you shared was a patient who had respiratory-like symptoms and had a respiratory or lower lung illness, which is the pneumonia. And what we're finding in the limited research that we have with COVID-19 is that this has multiple systems that can be affected by, sorry, I hit my pad with my pinky, multiple systems such as the lungs, the heart, the kidneys, and the liver. And while she may just have had pulmonary symptoms, the bilateral pneumonia, the lungs bring in oxygen, and that oxygen transports over to the heart, and the heart pumps the blood, which has oxygen, to all your organs, like the liver. And so we're finding that even though some of the signs and symptoms that each patient has, it's very, very personalized. And so for her, with pneumonia, one of the things that we're finding in some of the later evaluations of our patients is that there can be scar tissue in the lungs. And so that is damage. Now, this typically doesn't happen with your athletic, young, healthy lung. This is people who are older, 65, older, comorbidities, things like diabetes or renal failure or hypertension, obese. So they are kind of just like they were the high susceptibility of getting the COVID-19 virus, they're also the high susceptibility of having longer term effects. And interesting enough, you were talking about how it's been, 6 weeks since the onset. And in young, healthy individuals, we've seen a month to 6 weeks after the end of the illness, right? So I think one time I talked about, we've had patients who've had positive viral, or the PCR test, which is the nasopharyngeal swab test 30 days after initial onset. So that's 30 days. And then throw on another 6 weeks onto that, give or take, you're looking at 3 months, right? From time of illness.
Yeah.
And that's possibly for your young, healthy individual. And so they are saying, some of the researchers are saying that depending on the person, we may find that people who had comorbid conditions, in other words, multiple chronic illnesses, may take 6 months, a year, or even 5 years to get back to a normal form of recovery. And this is things from looking at literature from Harvard to Yale to some of the virologists in different things that are going on in China. While many people are like, well, I don't want to hear what China has to say. China has some of the leading virologists in the world, and it's predominantly because they have so many people and they're so close together, and so viral spread is so much more prevalent than here. And we see it in our country too. New York, Boston, Philadelphia, Miami, New Orleans, Seattle, Los Angeles. Those are our high density populations. When you look at the areas that don't have those dense populations, you don't see the same kind of numbers.
That's a little bit scary that the recovery, like full recovery period, could potentially be that long. And for the record, she is very healthy, not obese, very active. She's in her 50s, so she is not old, for the record. 50s are like the prime of your life, for the record. But no, she's, and I think she's doing fine. I just had noticed that, she'd made some comments that her, just her stats, and she's got a healthcare background also, so she knows the things to look at. And her pulse rate and all of those things that I don't really understand.
Sure. And so remember, when we don't have oxygen, we die.
Right.
When our cells don't have oxygen, our cells die. And so we have all these different systems in our body. And so if they don't have oxygen, bits and pieces die. So we hear people having a heart attack, and then they want to know, did I have permanent damage? Well, so if there's parts of the heart, and if we consider this the heart, and we have these arteries, so you can see my face, going across those coronary arteries that surround the heart, oxygen gets through those coronary arteries to feed the heart. When those arteries get blocked, then that part of the heart doesn't get oxygen, and then that causes the heart attack. And so if the longer period of time it doesn't have oxygen, the higher risk of that part of the heart dying. And then once it dies, it doesn't get better.
It doesn't come back.
Yeah, and so if you think of the lungs in the same capacity, if you have bilateral pneumonia and it gets so bad, now in her case, she wasn't hospitalized. I'm really referring to people who were hospitalized. If it gets so bad that you're hospitalized and you end up in the ICU and you end up intubated, then we're pushing oxygen into your body, trying to get your body to get some of it. That's a whole other discussion if that's the right thing to do or not, because the death rate's extremely high, or mortality rate's extremely high for ventilated patients with COVID-19. But getting all that oxygen in that part of the lungs, not getting oxygen, if it doesn't get oxygen, then that part of the lungs can die, or you can, have lung damage. And so it may take a lot longer for it to heal. And so my recommendation is, you have to, we talk about lifestyle change a lot with me. And so the lifestyle change is, if I'm used to exercising, 4 or 5 days a week for an hour, I may have to change that to 7.5 minutes or 10 minutes to start off with, and use a stepwise approach. So if we use a stepwise approach, we can say for 1 week, we're going to do this. We're going to do mild exercise. So in other words, we're going to do a mild walk with no incline, so no steps or anything like that, for 10 minutes. And when I say 10 minutes, that's 5 minutes away from your house and 5 minutes back. Maybe no resistance. So no resistance training, so no lifting weights, and those kind of things. And just really start to listen to our bodies. Here in the United States, we're very impatient people.
We are.
Because
for
of
sure.
technology, because of technology, instant gratification is a huge thing for our culture. And so I'm looking forward to the blessings that are actually going to come out from COVID-19. I'm hoping that my patients and future patients actually take a step back and say, what lifestyle changes can I make? What foods can I eat to build my immunity and build my strengths? And what can I do differently from a physical, mental, emotional, and spiritual perspective to prepare my body for these kind of things? Because this isn't going to end, because we're getting smarter. It's not because there's more viruses. I think all these viruses have been around. There's millions of them, right? And we talked about that in the past, that viruses are older than people. But our technology is getting better. We're getting smarter. So we're going to find even more.
Yeah, true. That's a very good point. Well, I know we need to wrap up because we both have some things that have to happen today. But in summary, so what I think I heard you say was, 1, it depends on the person. 2, there could possibly be long-term damage. 3, you need to ease back into old lifestyle activities and that sort of thing. Am I right? Yeah.
You're exactly right. So, considering that 4-tiered approach to healthcare, what we really want to do is, like you said, that lifestyle change, ease back into what your new norm is. I hope we don't go back to our old normal, to be honest with you.
Yeah.
So lifestyle change being the big thing, and food's the best medicine. It really is. So shop wisely, get the right nutrients in your body, avoid those foods with preservatives and stuff like that, and then work with your primary care provider, and hopefully they spend enough time with you to balance those things out, so you can be physically, mentally, emotionally, and financially and spiritually well.
I have a primary care provider that takes very good care of me, so I'm good. Well, thank you, Dr. John. I appreciate your time today, as always, and your wisdom. And I hope you have a wonderful day, and look forward to seeing you again next week.
Great. Thanks so much, Jannis. And if anybody's interested in reaching out to me, they can reach me at john@islanddirectprimarycare.com, or visit my website at www.islanddirectprimarycare.com. Thanks, and have a blessed day, Jannis.
Perfect. Thank you. You too.